This unit covers the schizophrenia spectrum and other psychotic disorders, and the somatic symptom and related disorders. It is important to have the vocabulary to describe the grossly disorganized thinking, abnormal motor behavior, and negative symptoms of psychosis. Delusions are fixed beliefs that are not amenable to change in light of conflicting evidence. Their content may include a variety of themes, such as persecutory, referential, somatic, religious, or grandiose. Hallucinations are perception-like experiences that occur without an external stimulus. They are vivid and clear, with the full force and impact of normal perceptions, and not under voluntary control. They may occur in any sensory modality, but auditory hallucinations are the most common in schizophrenia and related disorders. Auditory hallucinations are usually experienced as voices, whether familiar or unfamiliar, that are perceived as distinct from the individual's own thoughts. Disorganized thinking, which can also be called a formal thought disorder, is typically inferred from the individual's speech. The individual may switch from one topic to another, which is known as derailment or loose associations. Answers to questions may be obliquely related or completely unrelated. Tangentiality. Rarely, speech may be so severely disorganized that it is nearly incomprehensible and resembles receptive aphasia in its linguistic disorganization, called incoherence or word salad. Grossly disorganized or abnormal motor behavior may manifest itself in a variety of ways, ranging from childlike silliness to unpredictable agitation. Problems may be noted in any form of goal-directed behavior, leading to difficulties in performing activities of daily living. Negative symptoms account for a substantial portion of the morbidity associated with schizophrenia, but are less prominent in other psychotic disorders. Two negative symptoms are particularly prominent in schizophrenia: diminished emotional expression and avolition. Diminished emotional expression includes reductions in the expression of emotion in the face, eye contact, intonation of speech, and movements of the hand, head, and face that normally give an emotional emphasis to speech. Avolition is a decrease in motivated, self-initiated, purposive activities. The individual may sit for long periods of time and show little interest in participating in work or social activities. This chapter is organized along a gradient of psychopathology. Clinicians should first consider conditions that do not reach full criteria for a psychotic disorder or are limited to one domain of psychopathology. Then they should consider time-limited conditions. Finally, the diagnosis of schizophrenia spectrum disorder requires the exclusion of another condition that may give rise to psychosis. All of the disorders in the somatic symptom and related disorders chapter share a common feature: the prominence of somatic symptoms associated with significant distress and impairment. Individuals with disorders with prominent somatic symptoms are commonly encountered in primary care and other medical settings, but are less commonly encountered in psychiatric and other mental health settings. These reconceptualized diagnoses, based on a reorganization of DSM-4 somatoform disorder diagnoses, are more useful for primary care and other medical, such as non-psychiatric, clinicians. The Level 2 measure for somatic symptoms is indicated when the client responds with a score of 2 on items 9 and 10 of the Level 1 measure, which are unexplained aches or pains and feelings that your illnesses are not being taken seriously enough. This measure is an adaptation of the Patient Health Questionnaire Physical Symptoms, known as the PHQ-15. The 15 items are rated on a 3-point scale, so the total score ranges from 0 to 30. This rates the severity of the person's somatic symptoms for the past week. A score between 5 and 9 indicates a low level of severity, 10 to 14 a medium level of severity, and 15 to 30 a high severity. The DSM-5 also suggests a 3-item clinician rating scale for somatic symptom disorder. Total scores on this measure range from 0 to 12 with a focus on the past week. This measure is for tracking changes in the person's symptom severity over time. Schizophreniform disorder is coded as a subtype of the other schizophrenia category in ICD-10. You should have been able to see that because of the 8 in the 10th column. Schizophrenia is coded as unspecified schizophrenia in ICD-10, which you would know because of the 9 in the 10th column. ICD-10 uses a 5th character in their diagnostic code to clarify course. F45 is the dissociative disorders section of ICD-10. F54 is the behavioral syndromes associated with physiological disturbances and physical factors. F68 is the other disorders of personality and behavior section of ICD-10. The F44 section of ICD-10, conversion disorders, also has the dissociative disorders and the trance and possession disorders.